Hello everyone, welcome to my YouTube channel Let's Learn Bio. Today I am going to discuss regarding the Haemtinics drugs. Without getting late, let's jump right into a video. Let's discuss Haemtinics one by one. Haemtinics definition, Haemtinics drugs, adverse reactions, side effects and the mechanism of action in detail in this video. Haemtinics are the chemical substances which are used in the treatment of the anemia and required in the formation of the blood cells. The Haemtinics drugs will help in the increase the blood count. If in our body the blood count is in decrease, so we refer the drugs Haemtinics. Haemtinics drugs increase the formation of the blood cells and increase the blood count in our body. We know that the disease condition anemia. Anemia is a low blood level in our body or the low blood count in our body. Then mainly the RBC count is less or a decrease in our body in the anemia condition. To treat the anemia, we use the Haemtinics drugs. The Haemtinics drugs or essential Haemtinics are the iron, vitamin B12 and the folic acid. These all drugs are helps in increasing the blood count or help in the formation of the blood cells or used in the treatment of the anemia. Let's discuss one by one. Let's discuss the first Haemtinic iron. Iron is a main body constituent and in our body total 2.5 to 5 gram of iron is there, and iron helps in the production of the hemoglobin. We know that our blood is in red color because of the hemoglobin present in our blood, so it will shows the red in color, and RBC contains the hemoglobin but the hemoglobin contains the iron and protein. In our body, hemoglobin contains the 4 iron and those are helps in the carry the oxygen and transported into our body. Iron is stored in our body in ferric form and in the combination with the protein apoperitine. In 100 ml of blood, 15 gram of the hemoglobin is present. But in the 15 gram of hemoglobin, total 50 mg of iron is there. The daily requirement of iron is in adult male it is present in 0.5 to 1 mg and in adult female it is present in 1 to 2 mg, but in a children it is present in 25 mg per kg, but in the pregnancy woman it is present in 3 to 5 mg daily routine. It is a daily requirement of iron for the human beings. The dietary sources of the iron is the liver, egg yolk and dry fruits are the rich dietary sources of the iron, and meat, chicken, fish, banana are the medium dietary sources of the iron, and milk and its products are the poor dietary sources of the iron. It is regarding the dietary sources of the iron. Next, preparation of the iron. The preparation of the iron takes place in the 2 route of administration. One is the parenteral route of administration and oral route of administration. The first one is the oral iron. Oral iron is the most preferred route. For example, ferrous sulfate, ferrous gluconate, ferrous fumarate and ferrous succinate, etc. These all are the oral iron examples. And the adverse reactions of the oral irons are the nausea, vomiting, metallic taste and the constipation. These all are the adverse reactions of the oral iron. The second one is the parenteral iron. It is given parenterally in a deep IM or IV. It is given only in the condition of the failure to absorb oral iron and the oral iron is not tolerated. In that condition only we prefer the parenteral iron. And most adverse reaction of the parenteral iron is headache, pain in the site of the action, pigmentation and nausea, vomiting. These are all the adverse reaction of the parenteral iron. And main example for the parenteral iron is the iron dextrose, iron sucrose and the ferric carboxy maltose. These all are the example for the parenteral iron. The common indications or the uses of the iron is The iron is used in the deficiency of the iron or used to treat the iron deficiency. And next it is used in the pregnancy woman because the pregnancy woman needs more iron content in her body. So in the pregnancy time also iron drugs are used. It may be a parenterally or it may be a orally. Next it is used to treat anemia because the formation of the blood it requires the iron content. So these all are the uses of the iron. Next, second one is the vitamin B12. It is contains the two compounds. One is a cyanocobalamin, second one is a hydrocobalamin. These two are the synthesized by the microorganisms, and daily requirement of the vitamin B12 is 1 to 3 muesli. And dietary sources are the meat, kidneys, sea fish, liver, cheese. These all are the dietary sources for the vitamin B12. The preparation of the vitamin B12 absorbs through the subcutaneous route of administration or the IM route of administration. The drug cyanocobalamin and hydrocobalamin involves in the preparation of the vitamin B12. And the main uses of vitamin B12 are the vitamin B12 is mainly used to treat anemia and used to increase the formation of the blood cells and used to treat vitamin deficiency. In these all conditions, vitamin B12 are used. Next, third one is folic acid. Folic acid contains the folate and vitamin B9. And daily requirement of folic acid in our body is 1 to 3 mg. And dietary sources are the meat, cheese, green vegetables, egg yolk. These all are the dietary sources of the folic acid. The folic acid preparation involved in the preparation of the folic acid and the folinic acid. These are the main drugs which are under the folic acid, and these drugs are used to treat anemia and used in the formation of the blood cells and used in the deficiency of the folic acid. In these all conditions, folic acid is used. If you understand anything related to the Haemtinics in this video, please hit the like button and share the video to your friends and subscribe to my YouTube channel.